according to The Hill, the House on Wednesday passed legislation that would repeal much of Obamacare and defund Planned Parenthood. Of course. Now this bill, passed on a partisan basis from 240 to 81. Representative Colin Peterson, who opposes abortion, was the only Democrat to vote for the measure. Representative Bob Dole, Richard Hanna, and John Kotko, all Republicans, who go from swing states, were the only Republicans to vote against it. Now, obviously, this is dead on arrival, but it is actually going to President Obama's desk. It actually got through the Senate. Now, I'll explain how later. However, since even though Obama is certain to veto this, Republicans touted the vote as an important step towards, of course, reversing the Affordable Care Act. Paul Ryan said, quote, "We are confronting the president with the hard, honest truth. Obamacare doesn't work." Sure, right. Well, ask the millions of people who now have health care, who now have health insurance under the law. I'd say it works pretty well. Not to say that there isn't problems with it. Of course, I've always been for a single-payer healthcare system myself, but it is an improvement over what we had. Anyway, so how are they able to get this through Congress? Well, that's a good question. Republicans were able to get the repeal bill through the Senate by using a fast-track process known as reconciliation. Now, what does that do? That actually allows a bill to pass with a simple majority. Now, of course, Democrats not exactly happy about this. They voted, obviously, they wanted to try to filibuster it. They couldn't do it because of reconciliation. And Representative Luis Slaughter said, quote, "I've never been able to understand the Great Seal to take health care away from people." Well, I understand it. I understand it because they don't want people to have health care. They don't care about people having health care. That's why they want to go back and repeal this health care bill. That is actually, there are certain provisions in this health care law that people actually like. And people actually like having health care. Now, the funny thing about this is when you ask people about certain provisions of this law, they love it. They love certain things. The fact that you can have your kids stay on your insurance until they're 26, until they're able to actually afford to get their own. Or that you can't deny people health care based on pre-existing conditions. They love that stuff. And once again, there are problems with this law, but it's better than what it used to be. Now, of course, the stuff that they repealed, or trying to repeal, that they put into this healthcare repeal bill, well, it would take us back to what we had before. Now, Republicans, get this, Republicans say that they're playing the long game with the repeal vote, hoping that it will give voters a glimpse of how they will govern if they win back the White House. So basically, what they plan to do, and they're showing people, hey, you know that thing that you like? Gone. You vote for us, gone. That thing with provisions that you like in it, gone. We're going to get rid of it. Oh, but don't worry, we'll replace it with something. Such as? Oh, right, nothing. That's right. There is actually no replacement bill. None. Nada. Not there. Which is hilarious. Because they're like, repeal and replace, repeal and replace. Replace with what? Crickets. Now, of course, Paul Ryan on Wednesday said, just wait. We'll figure out something. That's like Donald Trump. Don't worry. We'll figure it out. It'll be great. Sure. Look, the law overall is unpopular with the majority of the public. Now, a lot of that, what they don't say is that a lot of that is actually because it doesn't go far enough. And it actually does hand over a lot of power to insurance companies and large corporations. A lot of Americans, they don't like that. They see these large corporations and insurance companies as ripping them off. Yeah, of course it wouldn't be popular. I wouldn't think that a law would be popular that hands over so much control to the insurance companies. Not the government, as they claim. But anyway. Uh, Representative Tom Price, for example, had said premiums are up, deductibles are up. I get calls from my former physician colleagues almost weekly telling me that my patients in their office are now electing not to get care because they can't meet their deductible. Well, that's because that's one of the problems inherent in a for-profit system that gives power over to the insurance companies. If we were to go to a single-payer system funded by your tax dollars, instead of it going to healthcare executives' pay and bonuses, it would actually all go to your healthcare. It would be more efficient. Look at Medicare. Look at these government programs that actually work compared to this program that is more of a corporate giveaway. Now, that's not to say that it hasn't helped millions of people. That's why I'm in favor of keeping it, but expanding on it. Republicans say, no, absolutely not. We're going to get rid of it. And then we're going to replace it with nothing. But here's the thing that got me the most about this. And this comes from Bruce Westerman, a Republican from Arkansas. He had said, he described the expansion of Medicaid as, quote, one of the most egregious parts of Obamacare. Egregious. How dare we give health insurance, we expand health insurance and health care to people who can't afford it. Those poor people, they don't need it. He said that Medicaid was traditionally for the aged, blind, and disabled, and that Obamacare wrongly expanded it to people who are working age and able-bodied. Yes, and who work but can't afford health care, health insurance, because the corporations have made a killing off of it. They charge so much that they can get a profit. That's the problem. That is the problem. Remember, this allows states to cover people at or below 133% of the poverty level. That's about $32,000 per year for a family of 4. You're not rolling in it. You're not rolling in it if you qualify for Medicaid. And this asshole wants to take it away. And so do the rest of the Republicans. Egregious. You know what's egregious? We pay for your health care. We pay for everything that you have. You get government subsidized health care. And you don't want to expand it to anybody else? Yeah. Fuck you, Bruce Westerman. Fuck off. So some of the things in this, real quick here. Some of this stuff, it basically eliminates the expansion of Medicaid and the federal subsidies that help people buy private coverage. So no more help from the government. No more help from anything like that. Here's some fucking bootstraps. Have at it. But it is delayed until 2018, which Republicans say would give them a time to think of something. We'll figure it out. It also gets rid of the individual mandate and the employer mandate. And it cuts off federal funding to Planned Parenthood. There you have it. The one thing that is most important to the Republican Congress in 2016, and one of the very first things that they do. Republican Priorities 101.